people go in and they are, they may go see their GP and get a referral to one place or to another. And, to manage Parkinson's disease, especially as it's advancing, that's really critical to have this holistic and care management that really is lacking in our public healthcare system. But if the disease starts to advance and more medication is needed, then as the nurse who's knowledgeable in Parkinson's disease can go in and say, ask some questions, observe, and then make that referral or the connection with the neurologist to say, hey, we think that this person needs to increase on their medication.
So there is no cure at this point in time for Parkinson's, but is that on the horizon? Like, is there even a glimmer of that coming that you know of?
So even with the biomarkers, Michael J. Fox Foundation, everybody's familiar with Michael J. Fox and his Parkinson's disease. There is no cure. It's multifactorial, and really the scientists, the neurologists that are trying to study what causes it. We know that there is in the scientific literature, there are some triggers. So genetically speaking, you could have GBA or LRRK2 or PINK. There are some genes that cause Parkinson's disease. But you may have the gene, you may have a variant, but maybe you don't have it. It really depends. And then you have the environmental factors, the pesticide exposure, the lead pipes. If you're living on a well and have your water pumped up from a well. So knowing what you're being exposed to or ingesting is one of our triggers for this. So being aware that we can do things to try to prevent. That's where nursing comes in. We've been trained as healthcare professionals to try to help and prevent as much as possible. Exercise is really key. Sleep is really key. So some of my clients have been told that they had old age. Well, no, they had Parkinson's disease, and once they were on the medication, things started to improve. So managing and observing in the different stages of Parkinson's is very helpful.